Good afternoon, everyone. Imagine this. You're 40 weeks pregnant, a long, grueling 40 weeks at what you think is the finish line, but turns out not to be. Your doctor tells you that it might be time for a medical induction of labor. For many, especially new expecting parents, this brings a lot of questions and scenarios that they may not have been expecting previously. Today, my intention is to provide individuals the knowledge and answers regarding what a medical induction of labor is. You will find out what they are, why they might be recommended, methods that may be used, and what the benefits and risks are with this procedure. My goal is not to persuade you, but to inform women and families to feel better prepared when the possibility of an induction is presented. Now, you may be wondering what exactly is a labor induction. According to ACOG, which is the American College of Obstetricians and Gynecologists, an induction is the use of medications or other methods to induce labor. Let's begin by looking at reasons that medical inductions might be recommended. Medical inductions are often done for health-related reasons. If the continuation of natural labor poses a risk to either mom or baby, this is typically when inductions are suggested to the patient. As previously mentioned before, the American College of Obstetricians and Gynecologists states that a labor induction is the use of medications or other methods to start labor. This is occurring usually before natural labor has started on its own and is used to speed up the process for many medical reasons. Providers at the Cleveland Clinic state there are many medical reasons an induction might be necessary. A few of those reasons being health conditions like gestational diabetes, high blood pressure, preeclampsia, or other issues such as not enough amniotic fluid, an infection in your uterus, or labor not advancing all on its own. This can all be causes for one to be induced. While these are all medical indications of a need to be induced, some providers also allow elective inductions. These inductions are for non-medical or elective reasons. What is an elective induction? Inductions that patients choose to have due to personal convenience, history of rapid deliveries, or even first-time mothers. They are often scheduled by choice rather than necessity and will typically happen around the 39-week mark of pregnancy. Some mothers may choose to schedule an elective induction for reasons such as distance from the hospital, history of fast labors, or child care or work plans, and even discomfort towards the end of pregnancy. Now that we understand the multitude of reasons an induction might be done, let's talk about how these procedures are done and the many options to consider. The common methods of induction include, but are not limited to, medications like Pitocin, which is a synthetic oxytocin to stimulate the uterus contracting, cervical ripening agents such as prostaglandins to thin and soften the cervix, medical dilation devices such as balloon catheters to help dilate the cervix, or even break in the water to release amniotic fluid and potentially start labor. The possible outcomes of inductions of labor, both positive and negative, include preventing pregnancy-related complications, preventing the risk of stillbirth, more control over timing, and a peace of mind for patients. While the risks include potential strong and frequent contractions which can cause the baby to go into distress, risk of infections, a failed induction which could potentially lead to a cesarean delivery or even a longer labor in some cases. In conclusion, if there is ever a time when the topic of an induction is on the table, whether it be in a medical necessity or elective purposes, you now have all the knowledge to make the correct decision for your future. Hopefully you are feeling less overwhelmed, learning what an induction is and that it's a frequent practice in obstetric care, and more informed to make a decision. There are many risks and benefits associated with this procedure, but hopefully the information I provided today has given you the confidence to make correct and informed decisions. Thank you.